Hello. We're running a continuation of the debrief today with the incident that has occurred with Dale just the other day. We have Tim and Matt here. Thank you very much for joining us.
It's okay.
I have to follow this up as per organisational policy and procedures towards this debrief, and this is just a short catch-up. And during this time we're just going to explore the situation, how it happened, and also just about any other emotions or feelings that you may have about the incident that has happened just recently. During this time I'm going to try and go into the point of all your workers' needs are in line, and also then we'll have a short talk just after it. But if you'd like to go first, Tim, about the situation there with Dale, and if you'd like to go first, you have to talk up.
Well, prior to coming to our youth service, I'd read his case file and hospital progress reports.
Yeah, that's done. Yep.
Yes.
Yep.
And so was it where he had been sleeping through a lot of his courses roughly for 6 months.
Oh, sleeping roughly, yes.
Yes.
Yeah, he'd been on the streets in Sydney and King's Cross.
Connections with his family was apparently non-existent after a breakdown. Relationships within his family, who live in another city. I'm not sure, but there was a story about Dale stealing money from relatives.
Yep.
Not too sure about that. All of us staff had noticed that over the past 2 weeks, Dale is becoming very quiet, introverted, non-compliant, withdrawn, and irascible.
Yep.
Spending increasing periods of time in his room and isolating himself from other young people at the service. To be honest, we've tried, but no one has had any success when asking Dale if there is anything that can be done to support him.
Okay.
If he wants to talk, staff and young people have all tried to encourage Dale to engage and talk to him, but he appears distant and closed off. Now, when the incident happened,
Yes.
Dale is sitting in the reception area with a few other young people who attend the various programs and play pool or table tennis. We had noticed that Dale had a container in his hand, and he is observed to be growingly increasingly restless. Suddenly his eyes close in his head and he slumps forward, falling off his chair and onto the tiled floor. Dale is unconscious. I was the first one to reach him, and Matt helped with CPR. This incident brought back so many memories of my cousin who recently died of drug overdose. When Matt and I raced to assist him, we go to him. We discover that he's unconscious and the container he was holding beside him is empty. Matt and I suspect that he has taken some sort of drug.
Okay.
We removed the other young people from the reception area and evacuated everyone outside. Obviously, some of the younger ones were emotionally upset. Some were in shock. Matt commenced first aid and called an ambulance, which soon arrives. We helped the paramedics undertake treatment and transport Dale to the town hospital, which is about 10 minutes away. Overall, I do hope Dale is okay and comes out of rehabilitation okay, comes to visit.
And during that time you were just mentioning about one of your cousins in the same situation overdosing. Has that brought back some emotions or feelings from that?
Yes, he had a very serious use of methamphetamine.
Oh, okay. Well, Tim, thank you very much for sharing all of that. We're also offering, if you do find that you need it, but we're also offering counselling and also professional psychologists to come here to our facility to talk to everyone that was involved in the incident. So if you really do wish to talk to anyone, they can be made available, or if you'd like some time off, that can be arranged also.
Yep.
Thank you very much, Tim. Now, Matt, is your approach to the story very similar? Would you like to share?
Yeah, I will actually. I was also aware that he was, excuse me, just getting comfortable, sleeping rough for about 6 months. The connection with his family was apparently non-existent after a few fights with his family who live in another city. And just like Tim, I also heard that the story about Dale stealing money from relatives, but I'm not really, it's a bit fuzzy, like on the full story, but you know, I've heard a bit about that. There were some signs and behaviours that raised my concerns that Dale was or may be using drugs. However, many of these signs are also common among teenagers here. So it's important I didn't jump to any conclusions. Some signs of drug use with Dale were...
What were some of them signs there?
He was also withdrawing from friends and family. He changed in and out of friendships or problems with friends. There's a bit of that going on. His grades dropped, or attendance at school. Didn't really show up as much as what he should have. He certainly had quite a few signs of sadness, depression, agitation, or even hostility. An increase in borrowing money from staff and some of the younger kids here. You know, as staff, he would ask us. Obviously, we're not allowed to give him money, but he was increasingly asking us for that. The evidence of drug paraphernalia or missing prescription drugs. We noticed that some cleaners had found some of antidepressant medication under his bed and bedside table. His moods would swing from, you know, happy to down and just, or he'd be just aggro.
Very bipolar.
Yeah, very up and down, and it was just all over the place, I'd say. Now, when the incident happened, just like Tim had said, Dale was sitting in the recreation room with a few other young people who attended the various programs and played pool or tennis, table tennis. We had noticed that Dale had a container in his hand, and he observed like shaking kind of thing, fidgety. His eyes were like bloodshot. Suddenly his eyes closed and his head slumped forward, and then he fell off the chair. He actually hit his head on the tiled floor when he fell. So yeah, he was unconscious. I was the first one to reach him and started CPR. I started CPR and we called the ambulance. I've also had a family member recently that has passed away from drug overdose, which it's kind of hit a bit of a sore spot.
So the kind of emotions and feelings in regard to this incident has really brought up some old memories, particularly they've hit very close to home.
Yeah, I guess it just made it's made everything just. I thought I'd dealt with everything, but it's kind of just raised to the surface again. So
okay. Okay. Well, thank you very much. I've really listened. I've reflected back onto what you've said. Just like I'd mentioned to Tim before there, Matt, that we're also offering a counselling service with trained psychologists and also social workers as well, but they're also very highly trained therapy groups as well. We would like to offer that here. Obviously, you have said to me how this incident has brought up some memories for yourself and feelings. We want to care for all our workers, Tim and yourself and everyone that's been involved in this incident. So we're willing to offer that, or even if you're wanting to use some of your time off just to spend. It was only just recently, this incident, so it's still fresh in a lot of people's minds. So we also like to offer that that kind of therapy as well there. So thank you very much for coming there today, coming out of work hours, and we do appreciate the care that you've given to Dale at that time, and both of you followed all policy and procedures that were required at that time.
Yeah.
So thank you very much, and I'll hand over the cards and phone numbers for all of these services that we can offer. Okay,
Yeah, I'd just like to say, I really do hope Dale does make a recovery. I know he's got a lot of challenges, but he's a good fella. Just needs to be pointed in the right direction and given the right amount of help. And
Well, when I visit him tomorrow at hospital, I'll pass on everyone's thoughts and feelings and prayer during that time.
That'd be good.
Thank you very much.